Okay, this is discussion assignment 11, vulnerable to euthanasia. So the three ethical considerations we should have about introducing euthanasia into the medical practice are potential for cruelty and abuse, psychological impact and grief, and erosion of medical ethics and trust. So for the first one, and then looking at the three different perspectives of the patient, the family, and the physician. So looking at the first one, from the patient's perspective, they might feel pressured to choose euthanasia if they see themselves as a burden to their family, especially if the patient isn't in an environment with limited support, and they'll be more prone to those pressures. For the family's perspective, they might pressure or influence the patient into euthanasia if there's financial or emotional challenges. So then the patient really isn't entirely doing it for themselves, but more from the external pressures from the family. And from the physician's perspective, they might face moral or ethical dilemmas if they think that the patient is being forced into it, and they wouldn't want to do it. For the second one, the psychological impact and grief. So from the patient's perspective, the option of ending their own lives might cause psychological stress because of the decision that they have to make, and it's not an easy decision, ending your own life. So it might have an impact on their head, on their mind, or mental health. From the family's perspective, they might go through emotional turmoil because they might think that what they're doing is wrong, or grief, or or the decisions that they made. So they're going to start questioning everything that they do, which will cause more problems. And from the physician's perspective, the repeated involvement of ending someone's life can also cause them psychological problems and grief, just because it's not, they're ending someone's life. It's not always the easiest. And lastly, for the erosion of medical ethics and trust, from the patient's perspective, if they were to normalize euthanasia, it could alter the relationship between a patient and the doctor. They might not trust it that much. From a family's perspective, they might second guess the healthcare system if given the opportunity to do it so openly without the proper procedures or the consultant, which won't establish good trust. And lastly, the physician's view is that bringing euthanasia into standard medical practice might challenge the traditional medical ethics. So overall, these are the three main points that we should consider if we want to bring or normalize euthanasia into medical practice. Thank you.